Well, ladies and gentlemen, we are now to be joined via Zoom call by none other than the Joint Drugs Controller India for the Central Drugs Standard Control Organization, CDSCO, Dr. P.B.N. Prasad. He's already on call and looking forward to interacting with each and every one of you, and it is a privilege to welcome him for his keynote address. Ladies and gentlemen, I direct your attention to the screen to Dr. P.B.N. Prasad. Thank you so very much for joining us, sir.
Good morning. It's a great day, and this is the day of post-pandemic, we can say. Hope you are listening to all the delegates.
You could turn off the audio to any other system that you have, sir.
I'm very sorry that I could not physically be present there in Mumbai. But I remember that in 2019 when this week was happened, I was there. And today, because of preoccupation at New Delhi with my official work, I could not physically be present there. It's a great day after the pandemic. Now we have almost reached near normal, or we can say that it's almost reached the stage of endemic. We all know how all the stakeholders in the healthcare sector, including the logistics stakeholders, how they shared and how they have worked all together in India as well as globally, how we have overcome this pandemic, the worst pandemic we have seen in this century. Today's program of Global Summit on Pharma Logistics, it's a great day. India is called as the pharmacy of the world. During the pandemic, we have seen how the regulatory system has worked, how scale we have gone in terms of approvals, right from initial stages of procurement of PPE kits to the provision of medicines, antiviral drugs, repurposed drugs, in vitro diagnostic, etc. And including the vaccines which we have come across, and we have scaled up, and how we have moved in terms of accelerated approval processes of the drugs, in terms of clinical trial applications, approval processes, repurposed drugs, and various other formulations. Manufacturing capabilities were scaled up, and the vaccine approval processes with respect to COVID vaccines and other essential drugs as well. If you can see how CDSCO and the state regulators for the drug regulation in this country, how they have collaborated with various stakeholders, including our ports, the airports and seaports, the officers, along with the customs, the DGFT, both in terms of exports and imports, how we have scaled up is magnanimous. Needless to say, the entire logistics segment has tremendously worked, and we have almost reached a stage where we are near normal in this overcoming this pandemic. We have seen how the government of India has announced schemes such as the PLI scheme, that is the Atmanirbhar scheme for reducing the import dependency and increasing the manufacturing capabilities, becoming self-reliant for the country, as well as export globally. As you all know, India has aptly called as pharmacy of the world because we have more than 10,000 manufacturing units, out of which nearly 1,000 units are US FDA approved plants, apart from the US. We have bulk drugs, we have formulations, and we have biologicals and vaccines, which we have been manufacturing and exporting. And you all know more than 50% of the global immunization stakeholder is India. Indian vaccines are accepted globally. If you can see the PLI scheme, how the government of India in the Department of Pharma has done magnanimously and initiated the program in the year 2020 under the Atmanirbhar scheme, the pharmaceutical linked incentive scheme, in order to scale up, innovate, and increase the production of bulk drugs, the production of pharmaceuticals, strengthening the pharmaceutical industry, identifying the gaps, and strengthening the pharmaceutical industry in terms of the good manufacturing practices, good storage practices, in order to meet the quality issues. Coming to the healthcare sector, if you can look into the issues, how the regulatory agility has moved, the scale of process in terms of clinical trial approvals, in spite of great difficulties, how the clinical trial approvals, accelerated approval processes, emergency use authorization of drugs, vaccines have been increasingly being done, and the regulatory system has moved day and night during the pandemic 2020 and 2021. A tremendous exercise was being done by the regulatory system and accelerated approval processes. And today we have reached more than 200 billion doses have already been immunized in this country. And just apart from that, India has contributed a lot of vaccines in the neighboring countries as well. So this shows India's pharmacy of the world. If you can see the Central Drug Standard Control Organization as one of the pivotal organizations of the healthcare sector, apart from the other areas in the healthcare sector, the drug regulatory system, how it has been strengthened. We have 13 ports, airports, and seaports, in addition to our regional offices and apart from the headquarters in Delhi. We have how we have integrated our systems. We have moved to online systems, online approval processes, in terms of licensing issues, in terms of approval processes, and in terms of the approval processes or integrating with the customs department, either IceGate or SWIFT methodology, which is incorporated in moving this. In order to reduce the time, we have integrated with the customs department in tandem. We worked how we have moved on and how there is a risk-based inspection, risk-based sampling was being done, how the ease of business is being incorporated into the system. The regulatory compliance burden has been reduced, relying more on the manufacturers, relying more on the logistics, relying more on the warehouses which we have. And if you can see the present system, in order to strengthen this system of the manufacturing capabilities, either pharmaceuticals or biopharmaceuticals, in order to strengthen even including, apart from the industry, even the common purpose vehicles we call as special purpose vehicles in the PLI scheme in the Department of Pharma, has involved in warehouses and other areas, ancillary areas of the basic infrastructure, the pharmaceutical industry, the pharmaceutical clusters. Pharmaceutical parks have been incorporated and has been leveraged by the government of India. Medical device parks have been started in various states like Gujarat, Andhra Pradesh. The capabilities of enhancing the testing facilities at ports, the mini testing laboratories exclusively for testing the drug samples of imports, especially reaching the country, and ports have mini testing laboratories in various ports have been established and is working. There we have, in addition to that, specialized laboratories for testing, and we have great challenges in these issues, especially biologicals, vaccines. We have a very, it's a thermolabile. The logistics problems will be there. The transport issues will be there, either in terms of receiving the drugs or exporting in terms of drugs or vaccines, especially which are cold storage or which are thermolabile. And how does we manage these issues? It's a great challenge. And these logistics, if you can see now, in order to create a ease of business or to reduce the logistics burden also. Now, recently, the Honorable Prime Minister of India has announced the National Logistics Policy in tandem with the Gati Shakti. That's how it is their National Logistics Policy, wherein we have the integrated systems of digital system, the platforms, the integrated platforms, and there are 7 departments which is integrated in terms of exports and imports. And the CDSCO, as a participatory government agency, in tandem with the customs department works in this regard, and the digital system, the ecosystem needs to be strengthened here. And therefore the national logistics policy is in order to reduce the challenges or mitigate the challenges which the pharmaceutical industry is facing. You can see in some of the small scale industries, there are real logistics problems. Leave about Mumbai and Hyderabad or Chennai, etc. But there are issues. There are industries in the belts like Uttar Pradesh or in Haridwar or the northeastern states or Himachal Pradesh. Logistics is a big problem. So therefore, mitigating this logistics issue is a very important thing in terms of transport, in terms of shipment, in terms of warehouses, in terms of cold storage, and how to reduce the burden in terms of the cost factor. So therefore, the national logistics policy is being announced, and we will see a better results in terms of logistics issues and the cost burden as well. As far as regulatory burden is concerned, we have leveraged, we have eased the ease of business without compromising the quality issues in terms of quality of drugs. There are challenges, of course, in terms of testing, in terms of time testing parameters, or in terms of release of drugs within the time frame. That's a big challenge. But we have strengthened, we are still augmenting the facility in terms of clearances at the ports or in terms of testing facilities at the mini testing laboratories or the exclusive testing facilities for biologicals and vaccines throughout the country. We have notified laboratories, and the new areas how we have enhanced. We have entered into a field of new domain, that's the medical devices. That's another challenging, and because we almost 80% of the imports of the medical devices into the country. Under the Atmanirbhar scheme, there were parks, medical device parks were announced. The medical devices bill, the medical devices rules were also there. And now there's a draft bill. There is a draft bill. The drugs, devices and cosmetics draft bill is also being in the public domain, and it is also it is going to be placed before the parliament. So we moved from the 1940 Drugs and Cosmetics Act now to the 2022-23, the Drug, Devices and Cosmetics Bill. As we see, we have scaled up. We have now, government has announced a lot of schemes in terms of medical devices. That's a big area apart from drugs, pharmaceuticals. Probably we expect that the devices is going to be another hub for the India in terms of manufacturing capabilities or testing capabilities. So that's how the government has taken a keen interest in terms of the medical devices. As you all know, the registration processes, the import licenses, how we have made it online. It has made it easier, and it has made it such easier that even you can the receiving, and you can with the timeline, with the time frame, you can receive the licenses either in terms of personal imports for the patients or in terms of imports of the registration and import for the medical devices, pharmaceuticals, and cosmetics. So we have integrated the system. We have reduced based on the risk-based sampling issues, inspection issues, physical inspections, etc. And we rely on those things. We rely on the strengths, on the standards of the regulatory system. In terms of exports, the ease of business has been leveraged, that there is no clearances. The clearances is straight away from the customs department. CDSCO officers were not involved except the merchant exports, wherein it is purchased and then being exported, where we ask the minimum documentation. Otherwise, this is completely as part of ease of business in terms of exports, straight away based on the standard documentation procedure, and relying on that documentation procedure, either from the licensing part of it, or the products, or the certificate of analysis, etc., or the shipping bill or invoice, etc. They're all, the customs department looks into that, and it is being cleared. So therefore, as part of ease of business, increasing the ease of business or augmentation of facilities in terms of manufacturing, testing capabilities, or approval processes, the CDSCO is being augmented. It has its facility in terms of the regulatory ease and regulatory clearances, at the level of headquarters in terms of approval processes or in terms of clearances at the ports, airports and seaports. We have many challenges in terms of re-imports, wherein probably there are some issues are there where, especially in terms of the re-imports with respect to the APIs or biologicals. So in terms of re-imports, how reprocessing is being done, and then again, quality is being checked and exported. There are challenges, definitely there are challenges, but in order to mitigate these challenges, in order to take these, in order to avoid these risks, policies have been framed, regulatory framework has been strengthened, and it is always, it's a dynamic process, both in terms of the guidelines which we frame it, the ease of rules, or even the present bill of the drugs, devices and cosmetics bill, which includes not just manufacturing or approval processes, but also imports and exports as well with respect to drugs, pharmaceuticals, cosmetics, and the medical devices. As you all know, the medical device rules have come in 2017. The cosmetics rules have been came into 2020, and the new drugs and clinical trial applications and approval process in 2019. So we have come up with a long way from devising the rules and going into the enactment process right now, both in terms of medical devices. The devices also is being there. If you can look into the web page of CDSCO, how we are registering it's a new emerging area, the medical devices. If you can see the class A, class B, class C, and class D, based on the risk of the medical devices, which there is, we have given a timeline for voluntary registration for class A and B devices from 1st October 2022. It is being implemented for voluntary registration of class A and B devices, and class C and devices take another year from 1st October 2023 for voluntary registration of the medical devices of risk-based C and D category of devices. So it's going to be another big hub apart from pharmaceuticals, the medical devices, an emerging area. And especially if you can look into the issues, both the devices and the in vitro diagnostics. And we have seen how we have overcome during the pandemic also, how the RT-PCR test has been done, how the rapid checks have been done, how the ELISA tests have been done. We have tremendously, we have imported, and now we are slowly coming up into that as per imported raw materials. But we have devised now, we evolved. There's so many startups in India where even the in vitro diagnostics have been devised and is being manufactured within the country. So we have come over all the way, and truly we are emerging from the manufacturing capacity and capabilities to the next phase of innovation capabilities. That's what the government of India is thinking, and various stakeholders, both in the Ministry of Chemicals, Fertilizers and Pharmaceuticals, as well as Ministry of Health and Family Welfare, is looking into the brighter prospects of how the pharmaceutical industry, not only serving the self-reliant to the country, but also supplying the global level. As you all know, how India has been from an importing country to a self-reliant, and today we have reached a stage where it is we are exporting globally many and more quality reliant. We can say the recent incidents, that's an exceptional cases which the government is thinking, and they will nail it. That's a different issue, but altogether we can see that the quality is definitely, it will be there, and the regulatory system is being strengthened, and we have various stakeholders in this process, and we have exchanges between international regulatory bodies as well as. So therefore, the systems are being strengthened, and there's no doubt, as we are pharmacy of the world, definitely, both either you can say either in terms of the drug substances or the active pharmaceutical ingredients which we are exporting, or the pharmaceuticals and the medicines, and even including the biopharmaceuticals and the vaccines. The role of this is very important. The challenges which the facing the industry is significant challenging is the logistics issue. the logistics, the last mile delivery is very important, and how the medicine reaches in the shortest time, the less cost, better infrastructure, better digitalization, and integration of all the departments which are the stakeholders in this logistics is a key issue which can resolve the issues and augment in strengthening the logistics and clearances of pharmaceuticals, vaccines, and medical devices. With these few words, thank you very much for sharing my views, and thanks a lot. And congratulations for this summit. I see that after almost 3 years, we again meet in this Global Pharma Summit. It's a great day. Congratulations. My best wishes to the organizers for the meet. Thank you very much.
Yes, indeed. Thank you so very much, Dr. P.B.N. Prasad, for your very valuable insights at this keynote address.